guided meditation earlier. That's my favorite. Oh my gosh. Okay. All right. So one of the big things that is on the rise nowadays is talking about mental health. Everyone knows, everyone's hearing all kind of good stuff in the news, probably at work, and everyone's talking about this big thing called self-care, right? So with self-care, just a basic overview here. I've been doing a lot of research in the past year or so in regards to taking care of not only just men, women, children, just everyone, just making sure that everyone's taken care of. So this presentation today, we're talking about actually Black women, okay? And one of the reasons why I did this presentation, I do have one that's Black men also, and I'm gonna be doing some other ones for different ethnicities and races. And I feel like all of us have a backstory, and all of us, all of our stories are different. And because of that, that's why I wanted to kind of put it out there, because I think all of us need to understand what the state of mental health is for everyone. We need to be very diverse with that. We need to understand what's going on across the board with different people. And I always tell people, we want to be kind to folks, okay? So you never know what's happening in someone else's home. But, in the whole big gamut of everything that's happening and going on, we definitely want to make sure that we are, treating others with respect, and we're definitely, being open and understanding. So basically, the state of mental health for Black women. When I first did this presentation, someone told me, I didn't know we were in the state of mental health. And I was like, oh, okay, yeah, there's a state of mental health for us. Yeah, for everyone, to be honest with you. And I think everyone know that COVID brought that to the forefront for all of us. So starting out here, just wanted to mention that Black women tend to face significant disparities. With that being said, in mental health, there's a lot going on. We're definitely trying to help Black women focus on the fact that we do understand that you are dealing with multiple roles at home. Not that other women are not dealing with it. This is women in general, but this one's specifically for Black women. And for the most part, there are a lot of things that are going on in society. We have a lot of racial concerns. We also have a lot of social injustices. We also deal with a lot of sexism. We deal with financial inequality. We definitely are understanding that as we are experiencing a lot of things that are going on, Black women is one of the most resilient group of women, that when we talk about groups, okay? And I say that not only from and you guys will hear me say from lived experience, I say that from lived experience, but I also say that from the research as well. So I say that just to make sure you guys understand that all of us are dealing with things, but in this case right here, this research really focuses on the Black woman. So when we're talking about Black women, that iconic phrase down there, a little saying is, Black women are strong. That's a cultural thing that has come out, and a lot of us are kind of dealing with that to a certain degree. And I mean, when I say that certain degree, I mean that there are some women that says, yes, I'm a strong Black woman, no problem. You have other women that are saying, no, I'm a strong Black woman, but you're not gonna give me everything to do, and I'm not gonna be pulling my hair out to do these things, okay? So the biggest part of that is we can be strong Black women, but we still have to make sure we're taking care of ourselves. We have to be very mindful of what we're doing on a daily basis. We gotta be very mindful that we are definitely pushing ourselves in a healthy way and not in an unhealthy way, okay? Moving right along here, when we're talking about just dealing with the stressors and the traumas that we deal with, there's so many things that are going on. There's so many parts, there's so many pieces to life that we're looking at. And when you think about, I did do a research with Dr. Burnett Ziegler, and she definitely has a few snippets that I think I'm not gonna be able to put them out there, but you're gonna be able to see them, and you're gonna have the links to it as well, because she has the video and the PowerPoint, so you'll be able to see those videos. But I'll be talking a little bit more about her, because she goes into really talking about a research study that she did, and she actually wrote a book also, and it really talked about Black women and how she learned things from generation to generation, and it went down. So if grandma was strong, then mama was strong. If mama was strong, then it just goes down down the line. If grandma was dealing with different things, you know, chances are it's something that kind of trickle down effect. We can move on here. Next slide. All right, so stigmas. Let's talk about stigmas with mental health. All right, so we're talking about the Black population in general, Black community in general. We're talking about basically there's often a stigmatized this mentioning mental health is a stigma. We know that. So what are some of the things you guys hear? Like maybe I'm not gonna go talk to someone. That's just
They don't know me.
If they don't know me. Okay.
What goes on in this house stays.
That part.
Oh, they can't help me.
Yep. So a lot of things we are looking at the stigmas and we're realizing that, okay, we gotta start looking at what are the reasons why, besides those things, what are some of the reasons? A lot of barriers that come along with, you know, trying to get mental health services and things like that. We go back to even thinking about, you know, what has happened in the past with getting not only mental health services, but healthcare services in general. So I did a lot of research on that. This research is not definitely, and this PowerPoint is not listed in here, but it is in my Black Male, the one on the internet. I have it on YouTube. And that one does talk a little bit more about the history of healthcare and what happened with Black America. So, but in this case right here, Black women do a lot. Black women carry a lot of different hats. We wear a lot of different hats. So we are the primary caregiver. We go home, we take care of the kids. We have the pressures that are coming from everywhere that make us feel like we got to be a superhero. We have to stand there with our, because we have to do this, right? So there's a lot to think about there. And then finding time to seek mental health support. That's something that's extremely challenging. And they're challenging for a lot of reasons, and we're going to talk about some of those reasons in a few. But the biggest part is less likely to accept medication. We're going to talk about that in two parts. Accept medication and then offer medication. So yes, most Black women, most Black Americans will probably not accept medication. You can offer it to them, but in doing this research, I realized that some of the doctors are not even offering it. And I'm like, okay, but that's what you're supposed to do regardless. You're supposed to tell me no, but if that's what you want to, answer, but I'm still supposed to tell you what the options are and what's out there for you, So that was something that I learned that I was just like, that's not good. So moving right along, a lot of the data shows that the stigma does not play a role in why Black women don't seek help, but more so depends on the prior experience with mental health services. We're talking about mental health treatment and services. I tell people all the time, everyone's experience is gonna be different. When you walk into someone's doctor's office, when you walk into someone's mental health therapy office, even to the point when you walk in and you have to go through inpatient treatment and you walk into someone's hospital. And those experiences are not great because I tell everyone, well, mental health hospitals, it's not the Marriott, it's not the Ritz-Carlton uptown, it's not, okay? So because it's not that, I tell people, I'm not sure what you were expecting because you might be in this scenario, but someone else is in a different scenario. And they have to treat everyone with respect and, kind of pretty much the same in a sense. But, they're gonna work with you. And a lot of people say that experience was just horrible. They didn't like that. They didn't like that experience. It was horrible going into the inpatient unit or, finding out what's going on there. Yeah. So
in general, what does that look like?
The inpatient unit?
Yeah.
Usually it's a locked facility and you have maybe 12 beds in there, and most of them you do have an individual room area. You may have 24 on the unit though, because they may have double beds, okay? So when they have double beds and, some people might, depending if there's a special population type situation, you can get a single room. If you have medical concerns or you have any other concerns, some of the gender differences, we definitely respect that for the most part, and we'll put someone in the, one room, in a room by themselves, like a private room. But there's really no such thing as a private room, to be honest, okay? Everything's fair game, yeah. And everything's on everything's on time schedule. Everything, yeah. The menu, the way they, provide the services in there. You have groups all day. you do some individual time, you see the psychiatrist, you get your medication, you might have some downtime, but that's kind of inpatient. That's inpatient treatment. Yeah. 4 to 7 days normally. Yeah.
My niece went, she was like,
Yes.
I don't want to go back.
Okay, next slide. All right, so when we're talking about some of the risk factors, there are a lot of risk factors, but I wanted to tap on some of these. I know you guys have other risk factors as well, so as I'm doing this presentation, if you guys want to jump up and add something, please add something. It gives me more information and more research that I'm doing as I'm continuing to do research on the topics that I do research on. But in this situation right here, so traumatized response. When we think about the traumatized response, basically being in survival mode, and that's kind of generational. We're kind of just surviving. And I hate to say it, you know, with Charlotte, with some of the prices have gone the way they are lately, I think all of us are kind of figuring out that we're surviving in Charlotte. Yeah, okay. All right, and then family-related stress. A lot of times there are family things that are going on. Whether you're taking care of your children or you are dealing with the fact that their mom and dad have to be taken care of, and then you got your kids, you got your spouse, and then you're dealing with family members, that extended family situation. Social stressors due to racism and genderism. We have a lot of that going on. Health issues that come up. We have to also think about the occupational concerns. Code switching, microaggressions, we have to be mindful of those. Stressors dealing with relationships, concerns with social justice, and move around down the list. Everyone can definitely read here. So, financial issues is another one that a lot of people don't talk about. That's one of the things that I do talk about. I talk about all the time. Financial health, it's a thing, yay! Especially since we're in the predicament we are in currently in the world, okay? So, for the most part, culturally, Black women are expected to, be people expect us to be strong. So we, being strong and all that can lead to a lot of anxiety and depression, hypertension, diabetes, heart disease, and other medical issues, other mental health issues, lots can happen. So with that being said, are there any factors that you guys can think of that might be, per se, a risk factor? Or you think I covered it all? Fertility. I like that. Yeah, that's a real good one. I talk about pregnancy in this one too, as far as understanding that could be a concern. Yeah.
Also, I think rejection.
Mm-hmm.
I think a lot of our sisters, they deal with rejection, whether it's I've been on this job for 10 years, nobody sees me.
Yes.
I'm the first to get here, the last to leave, you overlook me. Mm-hmm. Or even in, like you said, love life. Mm-hmm. Why am I not a wife yet? Mm-hmm. That's a big one I hear, women talk about.
Yeah. Exactly. Thank you. Those are some big ones, yeah. And a lot of that is, especially the relationships, that's a lot of societal stuff.
Yeah.
That's what society said we should be doing. Yeah. Should we really be doing it though? Mm-hmm. If we're not ready, probably not, All right, next slide. All right, so barriers to mental health care for Black women. Lots going on, right? So basically, first one, the limited providers that are out there that are culturally competent enough to really work with individuals, A lot of times I tell people with those statistics right here, with 2% for psychiatrists and 4% for psychologists, you gotta think about it, A lot of people are going into the field, but a lot of people are not really going in the field with that cultural competency. Kind of like those lived experience, like I always mention lived experience. So because they're not going in the field and they don't have that experience, they still have to deal with getting their cultural competency. We are licensed to have that in place. We have to have cultural competency. I think we have to have like 40 hours as counselors. I'm not sure if the psychiatrists or the psychologists, but we have to have like 40 hours every 2 years. So in hours, I think it's about 3 hours max, 3 or 4 hour training max that we have to have on cultural competency. But as y'all can see, I'm always doing something with cultural competency because I'm always talking about different things. So if anybody's got my YouTube page, I have a lot out there. And we're just starting. So I say that to say, mental health providers, basically it's difficult for a lot of women to, go sit down and speak with a mental health provider that doesn't have that experience? Or don't know what you're talking about? You're going in there, you're talking about,
Not just that, but I wanna talk to somebody that looks like me.
yes ma'am.
So when I go to a healthcare, I wanna seek help, it's, I'm not getting someone who looks like me, or who comes from my background. And that can also deteriorate.
Yes.
So if I can speak to that, so you guys know that Synchrony offers an array of resources for mental wellness. I am the first one to advocate for it. I'm a huge advocate for therapy. I go through therapy myself, and when you call EAP, you can ask what you're looking for, and they will do the research for you, and then they will send you a list. So, so I've gone through therapy different times for different reasons or whatnot, and I remember when I was going through something a couple years ago, and I wasn't specific. I said, I just want someone African American, right? And I got a guy, and when I tell you, it was the creepiest session. I was like, I gotta be more specific next time. It was so, but it was just because of him, though. It was him. So just, so when you make your request, be specific.
Yes.
But our EAP group, they are very, very good in getting you what you're looking for. So.
I used EAP,
But it was him.
but the second time I tried to use it, they kinda gave me a pushback, because they said I used it the previous year. So is it year to year?
So it's 12 rolling months. So you get, so it's not calendar year.
Okay, cause I've done, I started in 20, and then I went in 21. So it's just 12 sessions all together.
Right.
Okay.
Good deal. All right. So, again, medication, talking about that again, medication management and therapy. A lot of times, they're saying that African Americans are less likely to be offered medication and therapy when they go in. But I want to say this, you guys do know, and all of you have probably experienced it, you've gone to a healthcare provider, any type of healthcare provider, because my eye doctor asked me the other day, okay? Any healthcare provider you go in to see, they're going to ask you, are you dealing with anything at home? Are anyone threatening you? Are you getting into any domestic situations at home?
Yeah, doctor asked you that, your optometrist?
Yeah,
Yeah,
because they have to ask too.
Really?
Yes,
Wow.
ma'am. They do. Everyone asks those questions now. When you go to the hospital, they're gonna ask you those questions. We ask in the emergency room, or the nurses ask in the emergency room before we get to them. Everyone is asking those questions now. Your primary care doctor, nurses are asking. Everyone's asking.
COVID
There's
valid.
Exactly. It definitely. I agree with that too. But I do believe it's a lot of just figuring out, making sure that we're taking care of the whole person. And I think that's the biggest approach that we're going to in the US, we're trying to look at the whole person versus being so much as, well, I'm just an eye doctor. I'm not going to ask her if someone's at home threatening her.
Yeah.
No, you will.
Yeah.
So, my eye doctor asked me. So, I say that to say, right now we're getting a lot of press for mental health, and that's a big thing. That's a good thing, because, we dealt with burnout and everything else. We'll get to some of that in a minute too. You can go ahead to the next slide. All right, so other barriers. Other things that may influence barriers, we're talking about accessibility, talking about transportation issues, underinsured or not insured, that can come up as well. We're talking about the services available. Social issues, child care, being a caregiver for your family members, poor quality of care, and the cultural matching. So definitely trying to figure out who's going to be my provider. Like you said, Black female or Black male, or Hispanic female, Hispanic male, whatever the case may be. When we're looking at what are some barriers you guys think that I may have missed on this list? Anything at all? Yes, ma'am.
Just from personal experience, my sister has some mental health issues, and I am her sister, so I'm not her parent. My parents are having a hard time managing that. So my concern is, what do I need to have lined up in order to assist? So maybe legally, is there something, if it's not a parent or a child, maybe look into that. How do you find assistance for that? Things of that nature. How do you provide that type of care?
Yes.
And make sure it is right for that person.
So the biggest thing is, in North Carolina, we have you can do One is the fact that you can actually get guardianship of someone if you feel like they will not, meet the competency standards. You can get guardianship of an individual. You can also work on getting the healthcare proxies and the I forgot the other one called, the power of attorney. And there's one more, I can't think of it, but there's another one as well. But there is one specifically for healthcare and mental health that you can actually have the individual complete that and get that done. But a lot of it is gonna start to go on the legal side of things, definitely with, and the other thing too is if the individual is willing to say, yes, mommy can have access, then mommy can get access all day long. Or dad can have access, they get access all day long. But if they don't say that, that's where it starts to get kind of cut and dry. Yeah. So when she's in her good time, which I tell a lot of my families, when you're in your good times, talk about stuff like that and see how willing they are to say yes and to sign and do certain things, But when times are not good, that's not the time it's gonna happen. Definitely not gonna happen when they're sitting in the emergency room with me looking like, why am I here? It ain't happening. I can't even coax them to do it. They like, no, I'm not letting mama know nothing. No. So, but we do come up with, we try to talk to them. We try to let people know that, hey, you want your family to know you're okay. And I usually tell them, I just want to tell your mom and dad you're okay. I want to put them at ease. I want them to sleep tonight. And most of the time they're like, you can tell them that. Tell them I'm good. I'm like, okay. That's as I'm working on them to maybe give the family some access, okay? All right, next one here. All right, so why is mental health important for Black women? Got a list of stuff here, but what are you guys thinking? Definitely we all can agree that many Black women experience anxiety and depression. I've experienced anxiety and depression. Yeah, comes along with just the things that we do. And I tell people, those are kind of common things that happens in life in general, depending on what's going on. Because if we think about depression and we think about grief, if we lose someone, there's a little sadness that come over us for a little bit.
Clinical depression.
Yeah. Clinical depression. That's once we get to those 6 months. That's what I always tell people. We start looking at 6 months, we kind of feeling, yeah. We start looking at it, more clinically at that point, and yeah. So the other one here, we're looking at basically encounter unique barriers of finding, again, culturally competent therapists. A lot of people want to make sure that person is, can understand that yesterday when I went to the store and so-and-so was on the corner and this happened, they're not looking at me like, that happened? Yes, it does happen in my neighborhood.
Right.
Okay? All right. Some Black women may not be aware of their emotions. And basically, those emotions, those symptoms, what's going on, they are related to anxiety and depression. But sometimes people just think, well, I'm just having a bad day. And I'm like, you've been having a bad day for a long time now. Yeah. Let's talk about it. Yeah. Mm-hmm. Yeah. You've been having a bad day for a good little, little bit now. Yeah. Yeah. So some of the traumas that Black women also endure, and this is basically Dr. Ziegler's statement, basically that some of the intergenerational trauma, childhood trauma, abusive relationship, pregnancy trauma, a lot of these things that go on for individuals, we don't realize that that's a concern. Even talking about, you mentioned infertility and dealing with that, or dealing with the fact that women now, it's coming out that a lot of Black women are miscarrying babies. That's a big thing. Yeah. So, is there anything that you guys think that I missed on this list? Anything at all?
Overall health.
Overall health?
When you're going through depression and anxiety, it breaks down your actual
Immune
body.
system, everything that's going on inside. Yep, it does. Absolutely. Yes,
I
ma'am.
think postpartum depression is the big one.
Yes.
I went through it with my first child,
Mhm.
and I think as we normalize those things,
Yes.
because my mom didn't go through it, I
Mhm.
couldn't identify it.
Yes.
I actually started identifying those symptoms because I found people talking about it on social media.
There you go.
In 2020, everybody was putting out there, there was nothing to do, so everybody went, bent down social media.
Mm-hmm.
And I identify with some of those, women, like, oh, I'm feeling this way, if you're feeling this way, this is normal, this is I was like, oh, so I'm not crazy. Oh, so it's not that I don't love my child, I'm just going through something. It's crazy that we had to, you know, let's say I didn't have social media, then for me, it was going to be so much of a, I am crazy, or I'm just alone in this, or what is happening to me, because when you don't normalize those conversations, when you don't, you know, express that to somebody else, or the people around you doesn't understand because they haven't been there, it's when we start becoming more and more, you know, hitting those emotions and not seeking therapy because, oh, it might be just me, it's just gonna go away, or, you know, so as we normalize those conversations, that's why it's important to know.
Oh, absolutely, absolutely. We have to start normalizing and understanding that. I tell people all the time, mental health is just like you go to your family doctor once a year to make sure everything's good and that you're, you know, mental health is one of those things probably that we need to start looking at as well, you know? Even if it's just a couple of sessions, or even if it's just somebody I check in with once a year, just make sure I'm good, kind of, you know, do a year in review. Hey, this year right here, what happened was I lost this, I did this, I did that, I did this. I just want to make sure I'm okay, you know? And for therapists, that's what we do. That's what we do. We have to have a therapist. It's not mandated, but if anyone's under supervision with me or working in anything with me, it's mandated. They have to have it. I tell them all the time, you can't just be working out here and not taking care of yourself. You got to take care of yourself to take care of other people. Yeah.
Anger. Anger.
Anger?
I know, you know, you get the angry black woman. Well, why is she angry? What is she dealing with? Well, you know.
Yeah. There's a lot going on. That's why I say being kind to people, because you don't know what anyone's dealing with. You don't know what somebody walked out of their home dealing with last night into this morning before they came to work. You know? You never know.
I will tell you, when the pandemic hit, and TJ can attest to this, it was an eye-opener for those of us in leadership to understand that what our employees was dealing with at home. It was a shocker and an eye-opener, and we realized as a company that we needed to do something to, even though we were offering a lot anyway, but we had to step it up a whole lot. Yes. Because we didn't realize just how bad it was and what our people were dealing with at home. And that coming to work was actually their safe place.
That was the relief.
And
absolutely.
It was an eye opener for us we didn't know so many of our employees were homeless, living out of hotels and in their cars. It was a huge eye opener. So, I mean, the pandemic, it was good in a sense where it allowed us to learn a lot of things that we were really blind to, right?
Yes.
It's a double-edged sword, so.
Yes.
Like she said, you know, we didn't have anything else to do, so we were just putting stuff on social media, but it turned out that it was a good resource also.
It was, yes,
If
absolutely.
you allow it to be.
Absolutely. I always tell people technology, it's a great
A
thing.
double-edged
and
sword.
It's a double-edged sword. Yeah, and find yourself and you be like, what? All right, next slide. All right, so we're talking about Black women taking care of their mental health. Some things that we can be doing, some things that we can start focusing on. And some of those things are definitely access to care, resources, understanding. You mentioned earlier that you guys have the EAP program. Support groups. Sometimes you do have support groups around the community. You may have support groups right here in-house that you guys are doing to kind of support individuals and support team members. Regular medical and mental health wellness checkup. Yes, like I said, they're asking those questions when you go in anyway. So, you know, if your doctor says, it sounds like you're a little, my doctor has this little thing where I fill out these little bubbles that tell him, oh, she's depressed, or oh, she's anxious, or whatever the case may be. And they ask you questions like, you know, so every so often, rarely, not, you know, those are the answers, you know? And I'm like, every so often I feel a little on edge, you know? And he's like, well, you deal with that. I'm like, okay, let's talk about it, you know? And then he'll talk with me, and if he feels that I need to go further, then he'll refer me out. Okay? Develop a group or peer supports individuals that might be going through something, and then you find out that, oh, you just, lost a child or something, or you just, had a baby and feeling kind of, did you feel a little, just communication. I always tell people that, communication. I know sometimes it's hard to communicate at work, but definitely sometimes it does, and I work in the hospital, so yeah. We're always talking to the nurses about, I got a pick on my finger. Yeah, we're always asking them about stuff, but having that group, just developing a group or peer support, so knowing individuals that probably are going through different things, seeking professional mental health services, and I like to stop on that one because seeking professional mental health services, yes, I'm a professional mental health professional, but I tell people all the time, I am not a person that will just beat you to the ground if you go to your pastor at church. Please go to your pastor if that's who you trust. If that's who you trust. I want people to be able to speak to anybody that they trust. For years before my grandma passed in 15, she was my therapist. That's who I talked to. That's who I balanced everything out with. Yes. She was in the ministry, doing it for years. All my life that I know her, she was doing it. Didn't hurt me none. So I don't, shy away from it, but I tell people now when you start talking to them and you start getting some deep trauma, some deep-seated different issues that are going on, then yeah, you might need to go ahead, and I'm sure if you are talking to someone that when it becomes too much, they're gonna say something. And I don't think they're gonna say it to hurt your feelings or anything, but they'll tell you need to go talk to somebody, and we used to take that very to heart when people say you need to go get some professional help. Okay, sometimes they might be saying it out of whatever, but sometimes they could be very well correct in that scenario because it's too much, okay? But I do tell people talk, you have to communicate, okay? I keep things pretty simple. We're talking about getting some good rest at night, more body movement, kind of doing some exercising, getting out, doing some things for yourself. Walking is a big thing that I do. Eating well, connecting more with people. More connection, not with people. Just but animals are, yes, there you go.
I wasn't even an animal person at first, but things happen.
And now,
I have emotional support.
connect with your animals, yes. A lot of people have dogs and cats that are emotional supports. Yeah. Meditation, you guys have your meditation every day. Yeah. Okay. And know your limits. I think that's one of the things that I think people don't really realize, that you've got to know your limit.
Yeah.
My limit might be totally different from her limit.
Right.
Okay. What you come over here and tell me might be totally different than what you can go tell her. Okay. So you have to know your limits, and you have to be respectful with people to say, okay, that's a bit too much. I don't know what to do with that one, but you know what? I'm going to let you talk to Larry over here. She can handle that probably. She can tell you what to do next, And you're just being honest. And you're being nice about it, All right, next slide. All right, so Black women coping with mental health. Basically, again, talking about different things that can be done to keep you going. I think I like to go into hydration and nutrition because that was one that almost took me out of here. I was building a business and getting myself together and trying to get through a doctoral degree and raising some kids and doing all kind of good fun stuff. And yeah, wasn't eating, wasn't drinking, wasn't sleeping either.
Oh yeah, no.
Oh yeah. Mm-hmm. So the hospital made us visit with me. I had to go over there and see them, and I stayed there for 2.5 weeks. But it's important. Yeah, and they were asking my family for the next of kin. So when they start asking for next of kin, you know what time it is.
Yeah, I know.
So I say that to say we gotta have outlets.
Please.
We gotta take care of ourselves. We gotta know that what we do means a lot to other people, and if we're not doing for ourselves, then
Can't do for other people.
yeah. So in some of these, just watching comedy, having a good time singing, reading a good book, meditation, prayer, just vision board, exercise, gardening, new routines, thinking about some of that. All right. As far as contacting your PCP, of course, when we're talking about how to find supports, your PCP should be able to give you a lot of information. She's already mentioned the PAP service here, but all of you guys that have a primary care doctor, if you have one or you're gonna get one or whatever the case, wherever you at, they will give you the information that you need to start finding more supports in the area, okay? When you go, I tell people, If you got a healthcare card, if you don't have a doctor that you see, you can go on the back of it, there's an 800 number there, and they're gonna tell you who's in network in your area. And when they tell you who's in network in your area, you can just start calling the list of people and see who's taken. And when you go in and talk with them, they'll tell you the next steps that you will need if you feel like definitely that's a concern. Other part is when we're talking about the just making contact with anyone that can help you. There's a thing out there called Psychology Today that's online. You can find a therapist on Psychology Today like in 2 seconds because we're all on there, all of us from every state. Yes. And thinking about when you go on Psychology Today, they're very resourceful with letting you know whether it's a therapist that deals with all the and I'm going to call it the alphabet because I can't ever get all of them right, but y'all know what I'm talking about, the LGBT. I can't get them all right, and that's something that my clients help me with, my younger clients help me with, and I tell them I am not very competent in that area. There's something, because it changed so fast for me, and I'm an old school person. Yeah, it changed something, and it changed, and it's still changing, like it's still changing. So yeah, and so they always help me out. They like that. They're like, oh, she 100. She letting me know that, yeah, I'm teaching her something, and they are, believe me, okay? But I say that to say, when you go in on Psychology Today and some of the other search engines, you'll be able to say, I want a person that deal with LGBTQ, yeah, all that. And then I want somebody that's a black female. I want someone that knows about losing, if you lost a child. I want someone who do blended families. I want someone who, whatever it is you want, it's there for you to kind of plug the boxes in. And those individuals will pop up.
Okay, so I'm gonna pause you right there.
Go ahead.
So on our Synchronet page, if you go to where it talks about health and wellness, it lists all our health and wellness coach, and it tells what each one specializes in.
Love it. Yeah. And so the coaches are also another way. I tell people, having a therapist is great, but having a coach will deal with some other things for you, and they deal with stuff that's definitely still very relevant. And I know most of them will probably do this because I've met a few. They will tell you once it gets to a certain level, they'll tell you, I need you to go ahead and see a therapist now. Because now you're going in that area where it's too, it gets a little murky and we got to send you over here to a therapist. Especially dealing with some of the traumas, some of the, whether it be a sexual trauma, whether it be a physical trauma, whether it be whatever type of trauma it is, they'll tell you that. Okay? All right. We can go on from there. All right. Okay, cool. These are the videos that we have listed here, and I think she's going to be able to send you guys this PowerPoint later, right? Okay, yeah. All right, so the video is basically just information from other women talking about the different things that they've gone through and how, and actually in one of the videos that's on there, there is a woman, a trans, how do you call it again? Transgendered. Yes. There's a transgendered female on there, from male to female. At the hospital, they have us go male to female. So male to female. And she's talking as well, and she has given a whole lot, and I think she does go by she, it's not they. So, yeah, it's definitely one of those things where you'll hear the conversations and you'll realize that, all of us dealing with something. All of us dealing with something. There's nobody that's isolated to, I'm not dealing with anything, I'm good. All of us dealing with something. All right, we're gonna go on past that and we're gonna jump into the conclusion. So conclusion, basically, these are things that we're thinking about as far as what can we do to make sure that we understand that we need to pay attention to our mental health. We gotta understand that we gotta, we're thriving, and we gotta be at the point where we can start healing. We gotta be at a point where we're putting our health over the hustle. Realizing that, yeah, the hustle's there, but if you're not here, ain't no more hustle for you. Yeah. Understanding, changing, avoiding trauma responses. We gotta also look at being able to understand our strengths. We have to value ourselves. You know what I'm saying? We have to realize what our value is. We definitely have to look at, doing some listening circles. I like that idea. That was one of the ideas from one of the videos, listening circles. The self-love journey, getting into that. I know a lot of women are into this being soft now. Yes. Soft girl era. Yeah, soft girl era is what I heard it is. Thank you so much.
Oh, they put a name on it.
The soft girl era.
I'm
Yes.
working on it.
Yes. So the self-love journey is something big, okay? All right, and then definitely protecting your mental health. I always tell people, protect your mental health at all costs. When you know it's too much and you know you can't, you know when things are too much for you. You know, you gotta be honest with yourself. You know, I'm not asking you to have a meltdown and break it. No. Know when enough is enough. Walk away and do what you gotta do for yourself to pull yourself together. You know, and if it means that you have to call and talk to someone else, please call and talk to someone else. Yeah. Move on to the next slide here. All right, so open discussion. Strong Black woman. What do you guys think about all these nice little words we got on here about being a strong Black woman? Yes, we're strong. A lot of times we're silent though. Huh?
I'm over the storm.
You're over it. Yeah, okay, girl. You got one in the room. Yeah, a lot of women are debunking it. Yeah, they're debunking it.
Yeah, my cape is in the closet.
Yeah, exactly. It was just their capes in the closet, okay. Kim Possible, I heard that one too, yeah. But we're definitely resilient. Yeah. We dealt with a lot. Aggression, what about that one?
I came a long way.
That's
Oh,
that soft girl thing.
Okay, the soft girl, okay. Soft girl Aaron happening over here, okay. All right.
Same.
Selfless, okay? Selfless, being selfless. A lot of us will I'll give you a jacket off my back right now and just sit up here and be cold. You know? You said too much. Yeah. I always tell people that my grandmother used to give anybody, my grandma had 11 kids and I was one of the kids in the middle of all her 11 kids because my mom was the oldest child, and I say, she didn't have a place, she just had a roof over our head, but anybody could come stay at our house if they got kicked out of theirs, so they didn't have nowhere to go. Saying, yeah, and if she didn't have a car big enough to carry all of us around, but she'd give you a ride though.
Yeah. Y'all got to wait, I'll be back.
Yeah, exactly. So yeah, a lot of these things, pushing through things, we tend to push through a lot. Sometimes we gotta take a minute to breathe. Yeah, that's one of the reasons why y'all see the information about the retreat. We gotta breathe a little bit. We gotta take some time for ourselves. Oh, it's some information on the table, just handouts. And then hidden trauma, some of the stuff that's hidden, and definitely some, most of the time we suffer in that silence. We're in a different era now. I think we are trying to break that.
Yes.
And I think we're doing that across culture, across ethnicity, it doesn't matter. We're doing that across the board right now. But I wanted to definitely do this presentation because I think, as we are called strong Black women, sometimes we don't look at ourselves and realize that we can be, we can get some support too. We can get some help. We can allow somebody to do some stuff for us as well. Okay? All right. Yeah, these are just some other open discussions about loving yourself, being passionate, selfish in order to have that self-love for yourself, understanding that good stuff. Definitely exposing your emotions. You know you angry. Yes.
They gonna know too.
But yeah, exactly. That's what I'm saying. But working on it. Yes, we gotta be working on these things. But getting some clarity out of it. Why am I so emotional about that? What happened to me that I figure out that I get so upset? Starting to work through some stuff. All right, reaching out for help and accepting care. Somebody want to do something for you?
Let them do
it.
See, it was really hard for me to do this.
Yeah.
Because I was so used to doing everything for myself.
That's a big one.
I did not know how to let people do stuff for me.
Oh yeah, for sure.
When you get in your soft girl
For sure.
area, you're gonna mad.
Get your soft girl air. All right, let's keep wrapping into this one. Yes. Okay, references. All right, so because you guys were so sweet and allowed me to come here to see you guys today, I brought door prizes.
Yeah.
So everyone got tickets.
All right.
Yeah.